I don't know about you, but I feel like every 3 seconds these days I'm hearing the word norovirus, norovirus, norovirus. And I'm like, really something else to worry about? And how come we didn't hear about it for quite a while and now we're hearing about it again so much? So we thought, let's find out what we need to know about it. And I'd say perhaps most importantly, how not to get it, especially as we're heading into March break period. That would put a major damper on your March break vacation.
Now, can I just say, we've talked norovirus before.
For
the
years,
word is not new, right? It's been around forever.
Mm-hmm.
Okay.
Exactly. But why is it back in the news again? So when we have these kinds of questions, we turn to Dr. Christopher LABOS. He is a cardiologist with a degree in epidemiology. You can catch him every Sunday morning at 8:10 on Weekends with Ken here on CJAD 800. And he joins us now. Thanks for your time, Dr. LABOS.
Oh, my pleasure. Thank you for having me.
So walk us through this, because Aaron and I are both saying norovirus. Like, I thought that was kind of ancient history. Is this something that's just been hanging around waiting to have a party again?
Well, to a certain extent, yes. I mean, norovirus has been around for a while. It was always making people sick. You would often hear about it in the news when there would be sort of an outbreak on a cruise ship or something like that. So cruise ships particularly are sensitive to this type of thing because it's a self-contained environment where everybody's getting their food prepared from a solitary source. So all you need is a contamination at the central source to cause a large outbreak in a situation like that. So there have been norovirus outbreaks before. We weren't hearing about them for the past 2 years because with all the public health measures that were in place for COVID, there just weren't that many norovirus infections in the same way that there weren't, many influenza infections or RSV infections. But, when those measures came to an end and people got a little bit more lackadaisical about stuff like washing their hands and whatnot, you're starting to see more cases. So you're starting to see more gastrointestinal illnesses because people aren't really washing their hands. They're not really being as careful. They're going out and eating more. And these are the types of things that allow this virus in particular to spread.
So, that's amazing because I've heard this in so many other things. You mentioned the flu as well, right? We had a big outbreak, but we didn't have it last year because people were so busy trying to be careful, not for the flu, but for COVID. We were washing our hands. We were taking extra precautions. Now we've stopped doing that, and welcome back all the old things that we had back then. So where does norovirus come from? Like, what's the source here? How does this get transmitted?
And food. Yeah, why is food involved?
Because it's usually contaminated food. Usually what happens is somebody has norovirus, so they have the disease, and then, they make the conscious decision not to wash their hands after they go to their bathroom. And so they have contaminated, they've contaminated their hands with virus particles. Then they go and handle food, and that contaminates the food, and that's how you get infected. So, when you have outbreaks in restaurants or dining halls or catering venues, it's usually because one of the employees has gone to work and then infected the food supply. That's why you see it also on cruise ships, right? You have a central source, one person gets infected, and then it spreads to everybody else. You also see norovirus outbreaks and infections in hospitalized settings or long-term care homes, where you're moving, personnel and equipment from one room to the other, and you're passing the virus along that way. So that's the thing. It's a question of inappropriate source control. So you're not actually cleaning things like your hands, like equipment, like high-touch surfaces, which allows the virus to spread from person to person.
So at home, family, kids, really the advice is what it's always been, right? It's wash your hands, better more often, I guess, than less, and just be conscious of what else?
Well, it's really cleaning contaminated surfaces. So if you have somebody in the home that's sick, they are unfortunately going to be having gastrointestinal symptoms. So those are, vomiting and diarrhea. They are going to contaminate surfaces, especially the bathroom. So cleaning that as much as you can is going to help limit the probability that somebody else is going to come and touch the contaminated surface. What's important also to remember is that an alcohol-based disinfectant isn't going to kill norovirus. When it comes to hand washing or disinfection, using an alcohol-based thing isn't going to work. You have to use a dilute bleach-based solution or something else commercially available that can kill norovirus. So those hand sanitizer gels that we have, the alcohol-based gels, I mean, they're very useful, they're very practical, they're very convenient when you don't have a sink around, but you really do need to use soap and water if you're going to get the traces of the virus off of your hands.
So wait a sec. So soap is good? Soap works?
Soap works,
in this
yes,
case.
Absolutely.
Okay.
Yeah. That's the problem. Like those alcohol-based solutions, they are helpful, but they don't kill specific things. They don't kill things like C. difficile. They don't kill things like norovirus, which is why things like C. difficile and norovirus are particularly problematic in a hospitalized settings. Everybody's going around using the hand gels for, a variety of reasons, mainly convenience, but they don't kill everything. And that's why you have to sort of hammer home the importance of still using soap and water as much as possible.
That is so interesting to me. So it worked for coronavirus, but it doesn't work for norovirus. I want to know what's the difference between norovirus and your run-of-the-mill gastro or, your stomach flu.
Well, here's the thing. Most stomach flus you've had have probably been norovirus. The only difference is that we don't usually test for it. Like if you get sick and you stay at home, unless you go to a hospital for some reason, they're not going to culture, your bodily fluid specimens to try to identify norovirus because it doesn't really affect treatment. I mean, it is probably the most common cause, or at least one of the most common causes of gastrointestinal illness. It's just that it's often undiagnosed and untreated. Same thing with, the flu. Most cases of flu are not actually diagnosed because most people don't go to the hospital to get a flu swab. It's diagnosed clinically. And so we make the assumption if you have no other sort of red flag symptoms like, blood in the stool or weight loss or anything like that, we assume it's a viral illness. And the most common one is probably norovirus, at least here in North America.
Okay, then Dr. Labos, I wonder, why are we so worried about norovirus? If it is kind of your run-of-the-mill stomach flu, why are we hearing so much about it? And how do you know when it's serious? Like, how common is it for it to become serious? That was a lot of questions at once.
Do you have to end up in the hospital if it becomes serious enough? Is that one of the issues as well?
Yeah, I mean, yes, it definitely is. Now, here's the thing. There's no treatment for this, right? Like antibiotics aren't going to make a difference. There's no medication that's going to kill the virus. When people end up in the hospital, it's because they can't cope at home. They can't keep food down. They can't keep water down. They become dehydrated. And so the people who are most vulnerable for this are, as with most things, the very young and the very old. So, most people are going to ride this out. It's going to be a terrible 72 hours, but you will ride it out eventually. The key is going to be, can you take in enough fluid to offset the fluid losses that are coming up through the diarrhea and the vomiting so that you don't go into renal failure. And it's really about avoiding the complications. So, some people are going to end up in hospital. That is, yet more people coming to the hospital for other reasons and for a reason that is actually pretty easily preventable. I mean, we've demonstrated that it doesn't take much to curb these things. It's really just a question of washing your hands and being a little bit responsible if you're handling somebody else's food. Like, these are not big asks for us to demand of society to prevent this type of thing, because even if you live through it, I mean, I think most people probably have other plans that don't involve, lying on the bathroom floor for 48 to 72 hours because you're, that sick from nausea and diarrhea. So, I mean, we're hearing about it now because the cases are going up. There were very few cases, and Health Canada, put out this release saying that they're seeing a rather drastic uptick of cases. They didn't put out firm numbers, but they said it's going up. So just to remind people, like, look, a lot of these basic things, the rules still apply. Washing your hands, especially after the bathroom, is very, very important, and we are not that good at it as a species. It's something we often forget, and it's something we have to keep hammering home to people because it's very easy to prevent some of these illnesses. We just have to do these very, very basic things.
So can I just say, so did you just say, is it 48 to 72 hours if you do come down with this? That's the window and how long you're going to stay sick?
Usually, yeah, that's like the average for most people.
Okay. And is it kind of like your normal situation where infants and elderly are more at risk?
Yeah, exactly. Okay. The thing that makes norovirus a little bit different than some of the other gastrointestinal viruses is that there's more vomiting rather than diarrhea with this. So vomiting is the major symptom, which differentiates it a little bit and makes it actually a little bit harder to deal with because it's harder for people to keep food down and to eat and drink properly to stave off the dehydration.
Yeah, so the idea, like so many other things with this one, as you're describing it, is if you can stay hydrated, that's clearly important if you come down with this.
Exactly, yeah. It's replacing all the fluid losses.
Okay. Dr. Labos, thank you. Appreciate it as always.
My pleasure. You take care.
You too. Dr. Chris Labos, cardiologist with a degree in epidemiology. So, yeah, that's what you have to watch out for.
Wash your hands.
It's always amazing to me when you think about how simple it is, right? It's not a drug. It's not a vaccine. Wash your hands. I mean, just soap and water.
I will just admit out of the gate,
crazy.
I still am washing my hands, but I'm not doing it super crazy thoroughly like I was during COVID. Like I was, you're there and you're singing happy birthday and doing it. I'm just doing the quick wash now. So I'm going to go back to how I was doing it before because obviously it was working.
Kind of giving you the impression it's not even that. It's not even anyone doing the quick wash anymore. It's like, I don't have to do that anymore. COVID's done. I'm not going to catch it from that. But clearly you do. There's something else going around.